Nephrotic syndrome, a fancy medical term which simply means the loss of lots of protein in the urine. This can be associated with swelling, shortness of breath, or even kidney failure. We're going to show you how a simple lifestyle intervention can help prevent or maybe even reverse such a debilitating health condition. Nancy, could you give that patient a call? Make sure they got the labs drawn. So I want to make sure they have it before they come to clinic.
Okay.
All right, thanks. Well, welcome to Montgomery Heart and Wellness, another session of Clinical Rounds. And I'm going to discuss a patient that we saw recently who had a condition known as nephrotic syndrome. This is a fancy medical term that simply means the loss of a lot of protein in the urine. It can be associated with low protein levels in the blood, and that can result in swelling. So quickly, this is a patient who came to us as a follow-up visit. He had increased swelling, shortness of breath, along with signs of heart failure and renal failure. Now, we knew he had chronic renal failure, and he had a condition of nephrotic syndrome that had been diagnosed in the past, but it seems like this condition had worsened acutely. So based on our clinical assessment, we admitted him to the hospital. He's a 53-year-old man. Echocardiogram done showed an ejection fraction of 30 to 35%. He had elevated blood pressure in the lungs. He had a history of heart attack. And the evaluation in the hospital as well as in our office showed extensive amounts of swelling. He was clearly short of breath. And recent lab findings showed that he had what's called proteinuria, lots of protein in the urine. This had been worsening over the last week, and he had noticed that he was having shortness of breath when he laid flat. That's a condition we could call orthopnea. But he had increased the diuretics at our instruction. However, he continued to get worse. So we admitted him to the hospital for further evaluation. Now, this patient had a long, complex medical history, history of heart failure, a weakened heart, high blood pressure in the lungs, a prior heart attack, kidney failure. He had an arrhythmia, atrial fibrillation, which went in and out of atrial flutter, another type of arrhythmia of the upper chamber. He was on oxygen at home. He had sleep apnea. So this is an individual who not only had this condition known as nephrotic syndrome, but this is an individual who had many other ailments, and he was on a number of medication, about 10 medications and supplements combined. So this is someone who I would describe, as I did in a previous talk, as having extreme chronic illness. Now, we started him on a nutritional detox. Once we stabilized him in the hospital, we started him on a nutritional detox as an outpatient. We put him on what we refer to as an anti-inflammatory nutrition plan. This is a plan that has two parts. The first part is to remove all forms of animal protein, cooked foods, processed carbohydrates, or the like. We have a mantra: it's not a bite, not a drop, not a crumb of any food outside of a detox plan. The next approach is to put him on the anti-inflammatory nutrition plan. The foods he consumed would be fresh, raw plant foods, fresh fruits and vegetables. He would consume this at liberty, and this would be a nutrition plan that would improve his overall well-being. Now, this anti-inflammatory process has a mechanism of action. Many people say, well, eat fruits and vegetables and something good might happen. But this is a very powerful intervention. How does it work? First and foremost, many of you may not know that fresh fruits and vegetables have chemicals that we refer to as phytochemicals. They can inhibit inflammatory signals from the immune system. Oftentimes our immune system gets out of whack and it starts to send inflammatory signals to have the body attack itself. This reduces inflammation by cutting off or blocking these inflammatory signals. It also promotes healthy gut microbiome. It also enhances the slowing of digestion and therefore decreases the rapid transfer of sugar across the GI tract, which can also trigger inflammation. So these raw fruits and vegetables have a very powerful chemical effect, and it works at the cellular level because all of these things prevent cellular stress. So As a result of this, what did we find? So after about 2.5 to 3 weeks of this intervention, this individual, we noticed that an increase in his serum protein level, referred to as albumin. Albumin is the main protein in the blood. If your albumin level is low, fluid leaks out of the blood vessels into what we call the interstitial space, which causes swelling. His albumin level, which was low at 2.9 when he was hospitalized, after we started this detox intervention, it went to 4.4 grams per deciliter. He also had a very significant weight loss, and we were able to take him off the diuretics. Why? Because he no longer had fluid outside the blood vessels. All the fluid went into the blood vessels, and it was able to perfuse the kidneys, where the kidneys was able to get rid of the fluid. So his weight, on average, reduced by about 16 pounds. Additionally, we were able to reduce his medication from about 10 to 5 medications. So we had a reduction in the number of medications that he required, largely because his body was getting better in other ways. When you reduce inflammation and reduce what's called oxidative stress, the body improves, blood pressure improves, heart rate improves, so he required fewer medications for these other chronic illnesses. And the big bonus was that his heart function improved. His initial ejection fraction was about 30 to 35%. It went from about 35% up to about 60%, with significant improvement in a very short period of time. And this was a collective effect or as a result of the nutritional detox. So what did we see on his actual echo? Well, here's the before image of the echocardiogram. We see here at the beginning, the heart is a bit thickened. It's a bit sluggish in terms of the contraction. And after about 2.5, 3 weeks of the detox, we saw that his heart function was significantly much more robust. The contraction was more significant, and there's much more robust contractivity. So this individual had an overall improvement in his well-being. And in summary, what happened? In a very short period of time, we saw a decrease in inflammation, a decrease in protein wasting, improved protein levels in the blood, decreased swelling, elimination of the shortness of breath, decrease in his weight, reduction in medication requirements, and improvement in heart function. So here's a very simple, aggressive lifestyle intervention that had a very powerful effect on an individual with many chronic illnesses, but many of them started to turn around in a relatively short period of time. So I hope this is very helpful to you. And as always, if you have any questions, leave them in the comment box. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.